Good morning, good evening, and greetings to all those watching us from different time zones. Welcome to our digital event on empowering pharmacy teams, leveraging global insights for self-care enhancement, organized by FIP, the International Pharmaceutical Federation. We are delighted to be delivering this event focused on self-care as an essential component of healthcare that empowers individuals and communities to take charge of their own health and well-being. It can also reduce the burden on health systems and improve health outcomes. However, self-care requires appropriate knowledge, skills, and resources, as well as the support of health professionals, especially pharmacists, who play a key role in providing self-care advices and services. My name is Farah Aqqad, and I'm FIP's Regional Engagement, Support, and Development Manager. If you can go to the next slide, please. And the next one. Today, I will be your moderator, guiding us through this informative session. First, I would like to introduce my colleagues. If we go to the next slide, the co-moderator, Professor Tracey Thornley. She's the Professor of Health Policy at the University of Nottingham. She's also part of the Community Pharmacy section and the Data and Intelligence Commission at FIP, among other FIP internal constituencies. Welcome, Tracey. Tracey will be chairing the panel discussion today, where we will hear from experts and practitioners from different regions and from different settings on how they're implementing self-care initiatives. And next, the event's facilitator, Diala Koudmani. She's FIP's Development Goals Project Coordinator, and she will be facilitating some interactive activities with our audience today. We will invite you to share some of your views and your experiences on self-care and to learn on some of the resources that you will find helpful during our engagement session. Now, if we go next, a couple of important announcements. This event is being recorded and we will be it will be available at www.events.fip.org for future reference. We encourage you to take advantage of this resource and share it with your colleagues who couldn't join us today. We value your engagement and input, and to all those listening, please feel free to send your questions through the Q&A box. We will be picking those up throughout today's session. Your questions and contributions, of course, play a vital role in making this webinar interactive and meaningful. Once again, we extend our warmest welcome to all participants, and we look forward to making the most of this opportunity to understand our understanding of self-care and the impact on pharmacy teams worldwide. So without further ado, let's proceed with our next slide. We would also like to thank Reckitt, our sponsor, for supporting this event, with a special thanks to Adrian Shefford, who's with us today as well as part of the audience. If we go to the next slide. Just speaking of self-care, we would also like to acknowledge that yesterday was the International Self-Care Day. It's a day that symbolizes the benefits of self-care experienced 24 hours a day, 7 days a week. The International Self-Care Day is an initiative of the International Self-Care Foundation, which is a non-profit organization that aims to promote self-care as a vital foundation of health. The theme this year was Self-Care Achieving Personal Goals, which highlights how self-care can help people achieve their personal, professional, and social goals. So we hope that you celebrated this day by practicing some self-care activities yourself that suits your needs and your preferences, and you will continue to do so throughout the year. So as the WHO says, self-care is not selfish, it is essential. Now, if we go to the next slide, let's do a quick run through today's program. So we'll start with a welcome and introduction session for 15 minutes. You will hear from our FIP team on the fundamentals of self-care, the FIP resources on self-care, and the community pharmacy team's understanding of self-care projects. Next, we will have the presentations by our experts, and we'll have an audience engagement activity, as I mentioned. You will hear from 4 speakers who will share their insights and experiences. And then we'll do a panel discussion with our presenters as well, and you will hear from the panel of experts who will discuss some challenges and opportunities for self-care enhancement in different contexts. Of course, you will also be able to support us with the discussion by submitting some questions in the Q&A box, which we will pick up and address later on. And then we will wrap up the session with closing remarks. If we go next, we will start by giving you a quick overview of what self-care is and why it matters. So self-care is defined by the World Health Organization as the ability of individuals, families, and communities to promote health, prevent disease, and maintain health, and to cope with illness and disability with or without the support of a healthcare provider. So this definition shows that self-care is not just about taking care of yourself when you're sick, but also about taking proactive steps to improve your health and your well-being in all aspects of your life. To help you understand the different dimensions of self-care, if we go next, you'll see the 7 pillars framework, which describes a range of activities that we can do to enhance and maintain optimal health and well-being. These are knowledge and health literacy. This means being able to access, understand, and use essential health information and services so that you can make informed and appropriate health decisions. Mental well-being, self-awareness, and agency. This means being aware of your current health status, your emotions, your goals, and your needs, and being able to take action to improve them. Physical activity. This means engaging in regular, moderate intensity exercise that benefits cardiovascular and mental health. Healthy eating. This means eating a well-balanced, nutritious diet that meets your caloric and nutritional needs. Risk avoidance and mitigation. This means taking preventative measures to avoid or reduce the impact of potential health threats like smoking, alcohol, infections, or sun exposure. And then we have good hygiene. It means practicing regular habits that keep you clean and healthy, such as washing your hands, brushing teeth, washing your food, etc. And finally, the rational use of health products, services, and medications. This means using health products, services, and medications responsibly and when needed, following the advice of the healthcare professionals. So as you can see, self-care is a comprehensive and a holistic approach to health that empowers patients to take charge of their own well-being. However, it doesn't mean that they have to do it alone. They can benefit from the support of healthcare professionals, especially pharmacists, who play a key role in providing self-care advice and services. So if we go next, pharmacists can help in many ways when it comes to self-care. They can educate patients on how to manage their minor ailments and long-term conditions through personalized guidance and information. They can foster patients' health literacy by helping them access and understand relevant health information and services, ensuring effective medication management and adherence by advising patients on prescription practices and over-the-counter OTC medications. In addition to that, pharmacists can provide essential self-care skills training by teaching patients on how to monitor and screen their health indicators at home. Importantly, integrating technology in diagnostic services, pharmacists can use innovative tools to enhance healthcare outcomes and support enhanced healthcare outcomes. Collaborating with other healthcare providers by creating comprehensive and centered treatment plans for the patients, and consulting with patients to understand their unique needs, preferences, and tailor the recommendations accordingly. And finally, lifestyle recommendations that includes holistic approaches to well-being, from nutrition, exercises, to stress management. So I hope this introduction has given you a clear idea of what self-care is and why it's important for the patients and for the world. Now I'm glad to hand it over to my colleague, Shirley Malianiti, who will share some FIP resources on self-care and our needs assessment project at FIP. Thank you for your attention, and over to you, Shirley.
Thank you very much, Farah, for the introduction. So in the next few slides, what we will do is to share with you all of the FIP resources on self-care. So this slide actually present to you some resources from FIP, which is about FIP reference document and also FIP statements of policy. So as you can see in the first slide, which is a pharmacy as gateway to care, helping people towards better health. So this is a reference document that we developed, which highlight the role of pharmacies in supporting the people's health self-care. And the second one, which is our statement of policy, And this statement emphasizes the importance and the benefits of self-care for the healthcare system, specifically related to the collaboration, interaction between patients and pharmacists. And this statement also outlined recommendations from FIP to the government, to the insurer, to the pharmacy organization, and to the pharmacists themselves. And the third thing here is basically our joint statement of policy with the Global Self-Care Foundation, Global Self-Care Federation on responsible and effective self-care. And this statement outlines the responsibility of pharmacists in supporting people's self-care and the responsibility of the manufacturer of self-care products. In this slide, you will see another resources from FIP, which is about digital events collections, insight board report, and also intelligence report. This slide, the first slide, the left slide is basically showing the report of our collection, our digital events collection, and it contains of the two series. The first series summarizes the key points of digital events conducting in 2022, focusing on the policy elements of pharmacist intervention in promoting the self-care. And the second series is about, again, it is about digital events, but it is focusing on the practice elements, where a range of experts with different academics and professional backgrounds, they share their expertise. So feel free to look at these resources as well. And the next in the middle, which is basically the self-care reclassification of medicines and its impact on access, it is a part of our roundtable report. And this report highlights that pharmacists play an essential role in ensuring and leveraging and sustainability of primary healthcare, including the self-care interventions. And the last one, which is this one, is our recent report on hygiene, about the role of pharmacists and what they need in order for us to support their role in this area as well. This slide contains the FIP handbook of the self-care, and this will be very useful resources for all of you who are practicing in community pharmacy. As you can see, like in here, the first one is about the cold, flu, and sinusitis. So it contains some guidance for you to manage symptoms and also to supporting the self-care related to cold, flu, and sinusitis. And the second one is a handbook for pharmacists, which provides an overview of the self-care importance for pharmacists and patients, including the conceptual frameworks on self-care, consideration regarding the current trends and barriers, and also relevant information related to different self-care conditions. And I can see also my colleagues has shared the resources on self-care as well in the chat box, which you can reflect back and looking back later as well. And the last resources that we have here, which is CPD Bytes. This is an interactive video. This is a series of video, contains like six episodes of CPD Bytes representing experience and views of 6 pharmacists from 6 different countries or regions to discuss pharmacists' role and experience in supporting patient self-care, specifically focused on managing the common ailments such as the common cold, sore throat, flu, reflux, skin infection, and urinary tract infection. The focus area of the CPD Bytes cover the importance of customer satisfaction, patient reassurance, patient loyalty, diagnostic service provision, patient empathy, counter staff training, patient triage, and interaction with physician in self-care. So I will encourage you to also access the CPD Bytes here, so you can look at and watch the video later on as well. So that's about the FIP resources. And in the next few slides, what I will do is to introduce our multinational needs assessment projects, community pharmacy teams understanding of self-care. So as we discussed earlier, introduced by Farah earlier as well, pharmacists have a huge opportunities on this topic. So what can we do to support them? From our existing FIP resources and literature, we know that it is important to assess the needs related to the education and training of pharmacists, health literacy of pharmacists and patients, and also how we will be able to support them in supporting people's healthcare. So that is why we conduct this project to investigate the community pharmacy team's involvement in self-care support. This will include their understanding of the self-care, their learning needs, their engagement to supporting people's self-care, and also the barriers and enablers for them to provide the services itself. How do we gather this information? So we conducted a desktop review with a literature review and existing resources, where we are trying to find out what it is out there. And then we follow that by developing an online questionnaire to the community pharmacy team to explore the perception and understanding of self-care, their learning needs, and also their barriers and enablers to support their role in supporting people's self-care. And we will share with you the link later on as well, where we would like to invite you to share your views on this. After the online questionnaire, we will follow up with the short interviews with the community pharmacy team as well to obtain a deeper insight, basically into what you think about what patients need from the healthcare professional team, from the pharmacy, and what kinds of support that you think you need from us to be able to support you in this role as well. And last but not least is basically today, which is the digital event that we organize, where we also try to identify the support that you will need as well. So this is a brief overview about the responses that we got so far. So we have a total of 155 responses across 37 countries. And as you can see here, we received quite a high number from the South Africa and also from Austria. But we also have some of the regions where not quite many responses that we received, such as America and also Western Pacific. So we would like to encourage you all to share your views to make sure that your country are represented in here as well. As we mentioned before, after the online questionnaire, we also have short interviews, and we would like to thank to all of you who express your interest to participate in the short interview that we will do. We will be in touch on this. Okay, so this is the information about the survey itself. So we need your help and your expertise in engaging in this survey. It is only 5 to 10 minutes, and you will be able to help us to understand the self-care in the community pharmacy setting, and also to help us identify the resources and the strategies to better support you in this role. To participate in this survey, please visit this link, which my colleagues already shared in the chat box as well. And you can also scan the QR code. The survey is available in Arabic, English, French, Portuguese, and Spanish. So we would love your views on this. And I will now give the floor to my colleague, Diala Koudmani, to facilitate the Mentimeter discussion.
Thank you, Shirley, and thank you all for joining us today in this informative webinar on enhancing self-care practices within the pharmacy team. Before introducing our speakers, we value your insight and opinions to make this discussion even more enriching. So we have prepared an interactive activity, and we'd love to hear your thoughts on this question shown on the screen, and we'll be using Mentimeter to collect your responses in real time. So the question is, what resources or support do you believe would be most beneficial in enhancing self-care practices within the pharmacy setting? I will be sharing the link to the activity in the chat box. You can use your web browser on your computer or smartphone to participate. You have time to submit your responses until the end of our speakers discussion, or presentations, I mean around 25 minutes, and then we will go back to present the results. Thank you so much in advance for your active participation, and I will hand it back to you, Farah. Thank you.
Thank you so much, Diala. We've shared the resources in the chat box, but if you cannot see this, we'll make sure that we follow up via email and we attach it to the follow-up email following the event. So that's something to note, because I can see in the chat box that not all of the participants can see the attachment. Thanks, Diala. And again, we'd like to encourage you to submit your answers in the Mentimeter activity, as we will revisit the results following the presentations from our speakers. So now we're moving to the second part of the event, where we'll hear from 4 speakers who will share their insights and experiences on how they're implementing self-care initiatives in their regions and their settings. We've divided this part into 3 themes, basically, and 2 sections. First, we'll start with the presentations and then the panel discussions. As I mentioned, we will focus on 3 themes. The first one is community pharmacy initiatives, showcasing successful community pharmacy initiatives. The second one is leveraging technology. And the third theme is highlighting the importance of patient engagement and involvement. So without further ado, let me introduce our first speaker for the first theme on community pharmacy initiatives. Jorge, welcome to the event. Jorge is an observer of the community pharmacy section. He's a member also of the Argentinian member organization at FIP. Please welcome Jorge, who will talk us about the community pharmacists in promoting self-care. Jorge, over to you.
Okay, thank you, Farah. Thank you very much, FIP and the organizers, for the kind invitation, for being part of this very valuable webinar. My name is pharmacist Jorge Slotke. I am observer of the community pharmacy section of FIP. And today I will try to make a brief summary about some initiatives that have empowered self-care at community pharmacies worldwide throughout the pharmaceutical services. Next slide. Yeah, so the community pharmacies offer a range of pharmacy services directed to promote patient self-care. These services are provided to empower patients to manage their health effectively and make informed decisions about their well-being, and we will see in the following slide some examples. Next. So smoking cessation is our first example. There are many countries where community pharmacies are offering these programs, where the pharmacists offer assistance and resources to patients who want to quit smoking, including counseling, nicotine replacement therapies, and support materials. It is a service, as I told, that is offered in many countries, for example, in Australia and Canada. Next slide. Also, we have the example of immunization or vaccination programs, where community pharmacies are offering many campaigns into the community pharmacies. We can mention some examples, for instance, flu campaigns, pneumo campaigns, COVID campaigns. As other services, it is one that give the patients better accessibility for the health system, and at the same time it helps avoiding crowding at the hospital. So it is very important for not just for the patients, for their self-care, also for the health system in their own. Other example, next slide, sorry, is the blood pressure monitoring, control, monitoring, and following up. It is a service that have empowered the self-care a lot in our country, in Argentina, because, as I told before, the community pharmacies is very accessible to everybody, and it is near to the people. And what the community pharmacies are doing, they are offering the blood pressure checks, helping patients to track their readings and identify potential hypertension concerns and cardiovascular risk. Since 2017, it is more than 5 years ago, the Confederación Farmacéutica Argentina, that is my organization, start a network with the Hypertension Society in Argentina. And it was at the end of a long work together that nowadays we have a remunerated and recognized service by the government, which was a very, very outstanding result. Next slide. Another services that is empowering patients in their self-care is the blood glucose monitoring, where pharmacists are guiding patients with diabetes on proper glucose monitoring techniques and providing information of lifestyle management to control blood sugar levels effectively. In Ireland, for example, they have the national professional standards to provide this service properly. Next slide. It is another service that is offered worldwide in the community pharmacy, where that it is the medication adherence program, where pharmacists helps patients to stay on track with their medications by providing reminders, adherence packaging, and counseling on the importance of compliance. Okay, it happens in many countries, as I told, for example, in Canada, and it is focused on the rational use of medicines. And sorry, it is the right medicine for the right person in the right amount, time, way, and duration. Summarizing, and then last service I'm going to tell you, next slide, is the dispensing and monitoring of COVID rapid test, the example that we had here in Argentina. It is a service that started working on January 22, where with the community pharmacists dispensing and reporting the results to the government. Although the situation is under control, thanks God, at that time, it was a service that gave people the responsibility for their own health and the health of others. And it is the important. After 18 months, next slide, we can say that more than 850,000 tests were dispensed at community pharmacies, with a 78% were successfully tested, and the 27% of the cases were positive. Summarizing and making a kind of conclusion, next slide, I can say that the community pharmacies will always be fulfilling a pertinent role for the health system. Also, the pharmacist as a sanitary agent is a key piece for the healthcare, the promotion of healthy habits, the prevention of diseases, and the education of patients for their self-care. And finally, and I consider it is very, very important, is the registration and publication of the results achieved thanks to the intervention of the pharmacists. It becomes fundamental for the visualization and awareness of both the community and the governments of the role of pharmacists within the health team. So next slide, and that's all. Thank you very much.
Thank you so much, Jorge, for the wonderful presentation. So you've shown us how community pharmacists in different countries are basically empowering patients to take charge of their own health and well-being through self-care. We look forward to your inputs as well during the panel discussion. And as a reminder, we've shared the biographies of all speakers in the chat box to save time. Please also remember to add your questions in the Q&A box if you have any questions to any of the speakers. So now let's move on to theme 2 on leveraging technology. Technology, of course, is a powerful tool that can enhance self-care, but I'm going to introduce Izene, who's a senior clinical informatics analyst and a member of the FIP Technology Advisory Group. Please welcome Izene, who will walk us and talk about the technology and how it can support self-care in different contexts. Over to you.
Thank you very much. I hope you all can hear me very well.
Yes, we can.
Okay, awesome. Great. So we're just going to kick off with Pharma 4.0. Thanks for the opportunity and great presentation, okay. Pharma 4.0 is an interesting fairly new concept, which is a derivation of Industry 4.0, which is a transformative concept that integrates advanced digital technologies like Internet of Things, artificial intelligence, automation into manufacturing processes. So what does that have to do with pharmacy? Because that looks more like manufacturing and engineering and all that. So when we come to pharmacy, we're now applying advanced digital technologies and data-driven solutions to transform pharmaceutical manufacturing and healthcare processes. And this enables smart and efficient production, personalized treatments, and improved patient care. And that is what we're here to discuss today, self-care, patient care. And so this innovative approach aims to enhance pharmaceutical care by leveraging data analytics, AI, which you're going to see examples of today, automation to optimize medication management. We saw that in the last presentation, improve patient outcomes, and as well as streamline delivery of healthcare medicines. So in the next slide, we're going to see examples of how technology that we just talked about is now empowering patients to take an active role in managing their health. So we have powerful tools now that can be used in the self-care continuum to make smart choices. So digital technology is available to support individuals along the self-care continuum. Of course, this continuum is much longer, but I chose the first four, which is daily choices, lifestyle, self-treatable conditions, and minor ailments. So looking at daily choices like what to eat, exercising, information on medications, you have a headache and stuff like that. We look at online information and advice, and more and more people are looking into online sources for health-related information. For example, I mean, all of us have a go-to website that anything we hear medication or anything health-wise, we all quickly go to our phones and check it. So our phones already are alone becoming like tools for self-care advancement, and our ability to Google, in quotes, correctly, it's also another tool for making proper and right daily life choices. And lifestyle, we look at lifestyle apps and wearables. We have over 350,000 as at 2022 by statistics, apps, mobile health apps, and we all have, almost everybody, I have a Fitbit, most everybody has a Fitbit now, and we check our exercise, we take our count, steps with it, we check our heart rate with it, we check do our exercise, our reminders for things, our reminders for medication, reminders to check your blood pressure, reminders for this and that. And those are things that are helping us to keep track of our lifestyle and make better choices. And when it comes to self-treatable conditions, you have the online symptom checkers and digital triage systems. These became very popular, even for people who are not attuned to technology during the COVID-19 era, where we had all those symptom checkers. Okay, it was like a triage. You know what triage is, and like you check, do you have a cough? Do you have a cold? Have you been exposed to somebody? It says yes. Do you have this? It says yes. Okay, now you need to go to check. And so we have those digital triage systems actually outside, much more expansive than what we had what we saw during the COVID-19 era. And moving further, we have minor ailments where we have integrated electronic health records. In this case, we have records from the lab, records from the whatever process you've gone through in the hospital. You have all your records integrated in one platform where when you go to see your doctor, he's not running around looking for papers for your test, for this test, for that test. It's all integrated in one system and you can have access to it. So this is where we can see digital solutions now coming into the continuum of care and helping us to make better choices, smarter choices. So some of these interventions that were spoken about before are things that are now being overtaken by technology. Sort of we work together, which you're going to see much later, that it's not technology kicking out the people, but it's a collaborative effort. Next slide, please. So we see that there's a lot of impact on patient outcomes and pharmacy services. We're actually having more informed patients. You and I are now more informed about our health. We calculate our BMI ourselves. We know our heart rates. We know when our heart rates it's okay, it's not okay, your BMI is too high, too low, you know which medications to know. Sometimes that there are basic things that you don't have to go to the hospital anymore. Or when you're having conversations with your doctor, you're talking from a more informed perspective. And of course, also there's reduction in hospital readmissions and complications because some of these things are treated remotely. We have telemedicine, you have telepharmacy, you have follow-ups that can be done remotely. And of course, the pharmacy service is transformed completely. And we have more efficient services, operations are streamlined, documents are no longer in paper. We're not losing documents in paper forms, but now things are on laptops and systems are more strategized and all in one place. And of course, improve access to care where more people can now have access to this care. And of course, there's reduction in costs. Next slide, please. So we look at, of course, there are challenges when even though we have many benefits of technology coming into self-care practices in the pharmacy sector, there are challenges and considerations. Of course, there are privacy concerns. There was a recent data breach in the US. And of course, everyone is talking about how this is going to be the death of us all. But then these are big data concerns, but there are things that can be done to make sure that this doesn't happen, like anonymizing, improving systems, cybersecurity. The second challenge you could have is accessibility challenges. Not everybody has access to the internet. Not everybody has money to buy a phone. So most of this is you have a phone or you have an app, which is either through a phone or a laptop, a smartphone. So internet is also a cost, and that's also a challenge. And then insufficient data literacy. So you could have access to all of this, but you're not able to actually translate that information you have, the data you have, to information and knowledge that you can use for yourself. So data literacy is also another point. Even for pharmacists ourselves, is where we even struggle. Some of we pharmacists don't even know how to use these tools. So how can we help our clients? Next slide, please. So looking at how we can integrate and collaborate for optimizing pharmaceutical use, there has to be a collaboration between the pharmacies, of course, the healthcare providers, and technology developers. So it's very important that there is a full collaboration and integration between these people. And collaboration allows for seamless exchange of patient data and fosters an integrated approach to patient care. And it enhances the overall experience for the patients and puts the patient at the center. So there's optimized tech use for pharmacy care and efficient workflows of enhances the overall experience, like I mentioned. So healthcare providers, technology developers, pharmacists. So a case study I thought about was electronic prescribing system. So where you have all these three players in the room, and you see that you can see that system of electronic prescribing actually working out well in terms of collaboration and integration. Next slide, please. And so, well, like I said before, technology should complement traditional pharmacy services rather than replace them. So we're not saying that the pharmacists and doctors and healthcare workers are not relevant anymore. No, we are not. It's like this ongoing conversation of AI will take over our jobs. Definitely not. So if your job is something that AI can do, definitely AI can take over our job. But what's happening now is that we all have to learn how to use the tools, these technological tools, to enhance what it is that we're doing in our fields. So it has to be a balanced approach where you have the technological enhanced self-care services that are integrated with in-person consultations and face-to-face interactions, and offers a collaborative and holistic healthcare experience for the patients. Next slide and the last slide. So looking into the future, what are the trends and opportunities for technology and leveraged self-care? AI definitely will continue to play an increasingly significant role in tailoring personalized care and treatment recommendations based on patients' individual profiles. So we're looking at AI and machine learning still being like key in whatever we're doing in terms of technology. Excuse me. So you have remote patient monitoring, you have precision medicine and genomics, you have telepharmacy and remote consultations. These three areas are the key areas we're going to continue seeing very much advancement in the near future, with machine learning and AI leading the front in the race in technology and healthcare, and from a 4.0 and industry 4.0. So just to wrap up, I'm just going to say here once more that technology is here to stay, and whether we like it or not, we have to embrace it both as patients and as healthcare workers. And so it's our point as pharmacists to see how we can integrate these technological tools in our everyday practice and in how we work with our interact and work with our patients. Thank you very much.
Thank you so much, Izain, for that informative presentation. So you've shown us how technology can support self-care in different contexts, and you reminded us about the need to maintain our traditional practice as well, but also integrate some useful digital applications and AI applications. But our next speaker is also a member of the FIP Technology Advisory Group, and if we go next, Professor Pauline has recorded a short presentation to build on Izain's presentation and present an example on how smartphone applications can also help patients manage their chronic conditions and improve their health literacy. So let's hear it from Professor Pauline.
My name is Pauline, and I'm from the University of Malaya. Let me introduce you to OLA, the oral anticoagulation app used in patients with concurrent atrial fibrillation and heart failure. The first page contains the general information about the patient, followed by the allergy, which includes food and drug allergy, the medical condition, and the list of the medications that the patient is on. The next tab, which is the blood thinner, lists out the name of the oral anticoagulation medication that the patient is on. The hemoglobin, as well as the creatinine clearance levels, are all documented for the patient. I would also like to introduce you to SMART, the self-management antiretroviral therapy application used in HIV-infected individuals. It consists of 4 tabs: knowledge, to educate patients; the analysis, which is all the documentation of the lab results, and a checklist of all the vaccinations that a patient needs to go to, and the support groups that are available for HIV-infected patients to contact.
Thank you, Pauline, for that insightful presentation, for providing us with that example. Last but not least, we have theme 3 on highlighting the importance of patient engagement and involvement. So it's the core pillar of self-care, our patients, who are the main actors of self-care activities. It's essential to understand their needs, preferences, and expectations. And our last speaker is a leader in this field. Koudmani Sehmi is the CEO of the International Alliance of Patient Organizations, IAPO. I'm going to hand it over to you to share some perspectives on patient engagement and involvement in self-care.
Okay, thank you very much, everybody, and thank you for giving us your time and this platform for our patients. I'll start off by saying that firstly, I must congratulate and thank all the pharmacists who have joined us for having been there for us during the pandemic. Without you going that extra mile, I think many of my patients would not have had their experience or have survived the pandemic as they did in good health and good mental health as well. So thank you from that. I'll start off by saying why patients should be important. One thing is that we know that the UN General Assembly is going to look at a resolution this September at asking for reorientation of healthcare towards primary healthcare sites, simply because we think that we need to build the base of our healthcare pyramids much more stronger. And this resolution will look at how patients should be part and parcel of this main drive. And IAPO wants to see a participatory, predictive, preventative, and personalized universal healthcare coverage evolve across the whole healthcare continuum. Participatory UHC starts with meaningful patient engagement, and that means also meaningful pharmacy engagement and decision-making value chains. Next. Let's look at the WHO's self-care pyramid. So do look at this document of diagram. It was issued in 2003, way back. And you'll see at the bottom of this pyramid is that self-care and informal community care and pharmacy-based services, yeah? So the bottom three tiers are very important for us. If we have to reorientate our healthcare towards primary healthcare, or to look at, make sure that we can deliver universal health coverage by 2030 for all, it has become important that self-care becomes part and parcel of that continuum with the pharmacy. And we work in tandem with this. Much of the upper end, which is the long-term district hospital and acute care, will be whittled out if we concentrate and put more effort on this. This pyramid needs to be reshaped. Can I have the next slide? Because firstly, the costs involved. If you look at self-care relative to the other top tiers, self-care has got very low cost implications, and especially with digital and telehealth, these costs can be reduced even more. And if you have good partnerships with pharmacists, then this has got a tripling effect, as we say, whereby we can keep patients out of clinics, and we can make them more healthy in their home. And as I heard from some people yesterday and in another meeting, that the point of sale has moved more away from the hospital to the pharmacy, and now it's going into the home online. So the point of sale of healthcare is moving very rapidly into the home of patients and near patients. Next slide, please. So this is a pyramid by Snefru. It's called the bent pyramid. And I use it as an illustration that, yes, before the pandemic, we believed we could build a perfect triangular pyramid of healthcare. But post-pandemic, we know we don't, A, our basic foundations are very weak, and B, we don't have the cost and personnel and people to build up a straight pyramid sharp point. So we have not to bend it. We have to go limit the resources, shorten the basis, and make sure we get there. So this is what we are planning for the bent pyramid to happen in our healthcare. And this happens combined effort of both the patients and pharmacy involvement. Next slide. Well, one more important thing that we have said or needs to be said in anything is that self-care and the WHO's Global Patient Safety Action Plan 2021-2030 go hand in hand. Please have a look at this plan. I think part of what self-care actually introduces, or it helps us develop through improving patient health literacy, the understanding of self-care pathways and other care pathways, is that reliance and understanding, and then also awareness of how healthcare impacts them and where that warning signs are in patient safety, adverse events, if you're taking medication, etc. So in the Global Patient Safety Action Plan, patient and family engagement is a central pillar to that we cannot have a safe healthcare unless we have got patient and family engagement. And that means safe healthcare would require both the pharmacy and self-care patients engagement to make that happen, either to avoid some of the adverse events or what we call medication errors, or some more important whereby we could seek prompt care, especially with heart attacks and others beforehand. Next slide, please. So what do we want and what are the drivers? I think this is very important for us to realize. On the left, we say for effective self-care to happen, we need high level of health literacy. And this is where what we already have got the driver is in the UK's NHS, they started a program called the Expert Patient Program. Please have a look at that. That is really about people with chronic conditions being supported and their knowledge, their awareness, confidence, and motivations being improved to a targeted program that helps them. So that's what we need first, a health literacy program. Second, we need health literacy development approaches to be digitized and personalized. We know we do need these same expert patients we have engaged in this co-creating of those messages, medium and messages for patient awareness and education. And here for personalization, I think AI starts playing a very important role. I've seen many interesting cases where patients have used ChatGPT to test out, well, what do you recommend for my condition? And with sophistication of such approaches and with the pharmacist's oversight in future, I think we will have that AI giving us personalized solutions for every patient, that we don't have to really work hard at it. It will be already there for them. Second, patient participation health literacy must be increased. I think expert knowledge is very important, their own personal lived experience and the way they've dealt with it. As you know, nowadays we undertook a study and we found out many patients are actually going to YouTube and are joining some WhatsApp groups, etc., to find out much more about their condition where they don't have insight or particular knowledge. If you have got 200 patients with the condition, chances are your particular symptoms and etc. will be reflected on that YouTube channel, but may not in your surgery where maybe there's 50 patients coming in with that condition, especially in rare diseases. I think it's very important. It's important for people to go in there for reassurance and awareness raising, and also to contribute. Maslow's, as you know, Abraham Maslow has said, but self-actualization. Many patients like myself find that it's important for us as the longer we live, the longer we survive. We try to share our secrets as to why, what are we doing right, and where did we go wrong in some cases. And then that also then requires developing expert leaders and patient leaders to advance awareness campaign. Now, the last one I think is something I've very been keen and working on was looking at how pandemic preparedness can be achieved through tilting or changing some of the enabling legal policy, practice guidelines and standards and institutional ecosystems. It's important that we create that. We make room for patients to come in. We need the legal frameworks to bring patients in and also make sure they are coming in, joining us, and able to participate in self-care, and providers of self-care solutions are encouraged to come in as well. Next, please. As I said, patient engagement doesn't stop just at that stage of making life of, taking the pressure off general practitioners or others, or making, what they're saying, driving care to the home rather than to the front line. It's also got an important social and pandemic preparedness angle to it. One is the general COVID and related. The other one is the AMR pandemic that we are waiting for. It's been already predicted that if you don't improve health literacy and use of antibiotics, we are going to precipitate that as we come. Our study showed that there was a rush to seek formal health professional engagement during the COVID-19 in its earliest days. Despite people not realizing, in fact, that a virus and bacterial infection are different things, but still they rushed into the surgeries, and the net effect was that we had patient safety issue raising, patient to health professional to health professional, and then health professional to patient spread of COVID started happening. In the end, we ended up absolutely scared still from healthcare, and some still haven't come back. Then I think low health literacy and AMR antibiotic abuse is still going on. We need to improve that. Virus versus bacterial infections shouldn't happen. I think I'm really thankful to the pharmacists for having helped us on AMR resistance. I think they should be more talked about and how they have really helped things out to bring patient education up. Then our study also found out that the poor over-the-counter regulatory frameworks and confusing over-the-counter access to analgesics, sore throat in some countries, especially France, hindered some self-care, or still hinders self-care behavior. In sore throat, one of the primary reasons when we asked patients, why did you, despite knowing this, that, the other about the virus and the difference between the virus and the bacteria, why did you go back into the surgery? They said, well, I couldn't tolerate the pain. So pain became the trigger that was helping. Now, if you could manage that pain through analgesics and others through self-care, I think we could prevent more people going in unnecessary and abortive visits to general practitioners. Then again, the WHO framework on meaningful engagement of patients in NCDs, where they said that expert patients or lived experiences, expertise in all right. I talk about self-care in NCDs, and this really brings us back to that. It reduces the overload on our NCD services during pandemic and post-pandemic studies that there is. And lastly, I think we have developed new agilities during this pandemic. I think something that we are grateful to, that the relationship between the pharmacists, community pharmacists, is even much more deeper and much more stronger. During the pandemic, pharmacists were not only delivering drugs to home, they were doing other things as well. I know pharmacists who were actually delivering some groceries as well to some patients and the pharmacists who were helping transfusion-dependent thalassemia patients access blood, etc. during this. And that relationship, I think, should go on. I would like to see the pharmacy, as it's already mentioned, it's the fourth emergency service for us patients now. And also the pharmacy should be more of a community hall, community kind of gathering where we all meet, not only for our drugs and other needs, but also to keep our communities sane and healthy, So a good pharmacy with good patient engagement is the heart of communities' health and well-being. Next. And I thank everybody for your time, and hope you continue working. And please do look at the Apple's work as we go along. Thank you.
Yeah, thank you so much to our speakers for their impressive, insightful, and educative presentation. They were much helpful. And thank you all who participated in the active engagement. Your participation is invaluable to us. Now let's take a moment to look at the results displayed on the screen. The question was, what resources or support do you believe would be most beneficial in enhancing self-care practices within the pharmacy setting? So we received quite a number of responses. I will go through them quickly. So the first one is visual resources such as poster and brochures. Second one is in self-care setting, best support, better patients' education through F2F interaction and counseling. Another key insight is free seminar for personality development and professional development. Also, we have more pharmaceutical interventions on patients' care and regimen. We also receive a very important one on appropriate good regulation on self-care. Diabetes detailed, exactly stating what is in and what is out of self-care, pharmacy function, good guidelines for pharmacy staff, social marketing. Also, we have comments on providing more a person with good health and method conditions and drug interaction monitoring and therapy. We also receive one insight on the correct dosage and correct duration. We have also made patient as a developing country. We need better supply chain management and better availability of pharmaceuticals, and we have limited manufacturing. Also, we need financial education and infrastructure support. On a global level or a global approach, we have all pharmacists saying the same thing and being recognizing within the healthcare community. Okay, I think we still have a few. One on patients, is patient-centered approach, which is very relevant and crucial to our context. It's about consultation and stickers to enhance patient adherence to treatments. Thank you all for participation. These all comments and insights are very crucial and to our context on self-care, on empowering self-care within the pharmacy team. For now, I think before we move on, Tracey, if you have any thoughts or inputs on the results on the screen from our audience engagement before starting the panel discussion, please do. The floor is yours. Thank you so much.
Thank you. And I just wanted to say thank you to everybody that is actually participating and inputting into the survey responses as well, because they're very, very useful. And I know FIP colleagues are going to be taking those responses following on from this webinar and looking to obviously analyse them and input them into the report. So would you mind just confirming, are we keeping the Menti open until the end of the session? Is it still open, Farah? Oh, you're on mute, but I'm taking that as a yes.
Yes, thanks, Tracey. So you can still add your answers, and we'll make sure that this is included as part of the report, because it will also inform some of our plans at FIP. Thank you so much for these inputs in advance. Back to you, Tracey.
Thank you. Would you mind if we stop sharing the slides now as well, and the panelist members just opened up their videos and came off speaker as well? That would be really, really helpful. I have got lots of questions that I want to ask the panelist members, because that was a really interesting, really informative session, but I'm also very conscious that others may have questions that they want me to ask as well. So I would really encourage you to put questions into the chat, and I will try and weave them into the conversation for our panelist members. So Waldeep, Zini and Jorge, would you mind just opening up your video cameras so everybody can see you, if that's okay? Thank you. Thank you. So, Waldeep, I know that you've probably only just finished speaking and probably just caught up with yourself, but from a patient's perspective, I was really interested in some of the insights that you gave and some of the recommendations from a policy and a professional perspective. I'm really interested in your views, just opening up this panelist session, as to what you think pharmacy teams can do to have a patient-centric conversation around self-care, in particular taking into account obviously the diverse needs of the populations that come into pharmacy and interact with pharmacy colleagues.
I think the first one, I think it's firstly to identify who your local expert patients are. You know, you can almost pick it up. You know, you'll see these are people who come day in, day out to your pharmacies to talk to you. And in one way is to encourage them to form a local pharmacy-based ad hoc group. You know, this could be just a simple meetup coffee, or maybe even if you're located within the shopping parades as many are, or sort of malls, meet up in the local coffee shop to discuss how things are going with the pharmacy, what can the pharmacy do for them, are they happy, or others. Also kind of it helps you to map out the skill sets involved. Patients are not patients as such. There may be some language skills that are important. There may be some insight, and some may be very good. For instance, in North London, one such program is in the Cypriot communities. They found that the thalassemia major patients lived longer. Yeah, many of them were grandparents themselves. Which is unbelievably amazing. But yet, in corresponding Pakistani Indian communities, that lifespans were lower, and they started having coffee mornings for both these parties to meet and talk. And very soon people began to realize what was needed, what was the secret of longevity, what are them. And it always comes down to, I think, self-care and motivation and that mental health support. And the pharmacists can play that. They're almost like free counseling service, So it's very important to have them on board on that. So that's it. And second, I think, make sure those language resources are accessed. I think many pharmacies, so many industry partners who are getting your product through your point of sales have similar point of sale furniture, posters. Don't be afraid to ask them. They'll send you something from somewhere else, custom that was designed for you, because the language will remain the same. Thank you.
Oh, Tracey, I think you're muted.
Oh,
technology again.
Thank you. That took several attempts to unmute then. Thank you. So you mentioned about about languages and different languages within your response then. I know there are different spoken languages, but Zini, I know that you mentioned around different mediums with regard to technology and access to self-care tools. So I'd be quite interested in your views on how, from a technology perspective, there are opportunities to use technology to help pharmacy teams, to help patients, and to be very patient-centric. And I know you talked about some of the AI as part of that.
Yes, I think this is where we should have a quick look at that. I think there should be, maybe FIP, I can put that as a recommendation. FIP should be looking at developing some AI solution for all pharmacies around the world, which could be tapped by any patient in any country to extract this information. As you know, in majority of the cases, all that information that's being pulled up in any of your leaflets is the standard information you're submitted to the regulators or others. And therefore, there is no, it's not a challenge to convert that into much more simpler infographics or simpler language, what they call idiot language, those things they used to call, that you can have that language in much more simpler terms, which can be matched to the patient reality of them. Because we are just scratching the surface at the moment. We still got AI automatically starts looking at you and your long-term history. I think we're, especially with machine learning, if you're having wearables, I think that's where the pharmacies now are needed. Those wearables are giving a lot of data. Yeah. And that data, I think, should be shared directly with the pharmacy itself. That there must be a way of asking the manufacturers to have some kind of open source which links your local pharmacies directly to that wearable. And that can improve the service delivery to that patient, especially when say for instance, I know prescription filling times. Yeah? I know one pharmacist has done that. He knows that for a particular group of patients, with this polypharmacy who need many drugs and that, each consultation is about half an hour and longer. But he also knows there are other patients who just drop in, drop out, pick up the prescription out. Now, what he has done is through this intelligence data gathering, he has timed up how to invite the polypharmacy patients to the much more slower periods in his pharmacy. And they've responded brilliantly because that pharmacy has got a time and also have some coffee, share coffee, talk and discussion, and the thing can be filled. Because for patient safety, those are high-risk patients. You can't be dealing a mixed batch of patients. And this is where AI can give you that. You can't be dealing with a mixed batch of low-risk patients with high-risk patients because you'll overlook. Something is bound to happen. So it gives you that priority. I think it helps you. Lastly, I think even your general sales register or prescription sales, whatever you're doing, that should be analyzed somewhere. FIP should be designing this for pharmacists. I think you look at how their weekly sales are going, what's going on, and if you anonymize some of these, you can almost make things disease specific and help them in that.
Yeah, thank you. I'm going to pass over to you, Azine, if that's okay. I know that and I know that basically because of the work that you're doing as part of the technology group, that there's different access to data varies tremendously in the intelligence that we can actually use from that. But I'd be really interested in your views, Azine, on the technology side and how we think we can use or opportunities to use technology to try and help support some of these conversations from a patient-centric perspective.
Definitely, like I mentioned earlier, the first thing is actually to identify who are the other players involved in this, and how do we make sure that at the center of it all is the patient. And so the other healthcare workers, definitely the doctors, the nurses, and then you have the technology part of the thing, which are the technology developers, which I also mentioned. So when you work with these people, there has to be collaboration, there has to be that integration, there has to be that conversation, like the other speaker keeps talking about. Need to have that conversation with people, because at the end of it all, it's the patient that matters, the patient that actually is the main thing. So there are different models, AI models, that are being used right now to make sure that we give the best care and best support to patients. So we have the natural language processing a bit, and GPTs, they're all called generative AI. And these are more or less what's being used in the chatbots now, like the back and forth conversations that patients have with chatbots on like symptom checker sites, where you just ask questions and you get answers back, like more or less personalized telemedicine sort of like, but you're chatting with your laptop or you're chatting with your phone. And so that's something that actually puts the patient at the center of it all. And we know that, of course, it's training, you're training the computer to recognize that this is a human being, and this is someone who has, the thought process, the thinking process is tailored towards that of a person. So having that collaboration, coordination, like I mentioned earlier, really helps a lot in this. And you have that in mind, things are patient-centric, and we have that all going on around the patient. And also the issue with AIs as well is that with the remote monitoring apps, we have the blood sugar monitoring, the glucose monitoring, where the reports their data and all the whatnot to the system. It's also another way of tracking this sort of things. And the doctor can now reach out back, or the pharmacist or whoever is on the other side of the spectrum can now reach back and follow up, you understand? So that's why I also mentioned that we are not taking away the human element here. We are integrating with the human element. So it gets to a point where in some cases, the technology ends and we've used the technology to help, and then the human element takes over. So we also have to be sensitive to that part of the continuum to know when it is that we've done the best we can do with technology, and then this is part now for the human or the person, the doctor, to now take over. So that's just a bit I can say.
Thank you. No, that's really useful. And I would encourage, I know there's a couple of questions that are starting to come through, and I would encourage anyone that does have a question just to pop it in the chat, and we'll try and get it through to either directly on this panel discussion, or we'll answer it through the chat discussion separately. Jorge, I'm just going to come over to you if that's okay, following on from the discussion around the technology. It would be interesting, I know you've done a review around various different services and relations to self-care, and you presented some of that information in your presentation, which was really interesting. And technology and access to records and access to data is obviously part of that, and that interface. Be really interested from the work that you've done and from your perspective, to understand some of the challenges that pharmacists, and in particular community pharmacists, face in helping to support patients with self-care.
Sure. Thank you, Tracy. I think even though, as I can show in my presentation, there are many possibilities to offer services that tend toward self-care. It is very important that those services are oriented and adapted to the needs of the local communities, right? For instance, service that is provided or implemented in Middle East maybe not be possible to implement in Europe or South Africa, and vice versa. I think the important thing is to be able to know what the alternatives are, which are the models that are implemented worldwide, and then to be able to leave the webinar that we're having today, which ideas that allow us to adapt them to our local realities. I believe that the dialogue and the education with the patients is very, very necessary to empower them and for them to understand that their health is in their own hands, and that the pharmacists, we are the facilitators for this happen, providing the necessary information and the required advice. Likewise, interprofessional network, I think that it becomes very, very important to make a comprehensive care and follow-up of those patients. About the main challenge, I think that for the implementation of pharmaceutical services that aim to improve the self-care, from my experience and what I hear from my colleagues here, is that the administrative times within the community pharmacy, mainly in small and medium-sized pharmacies that don't have a lot of staff. However, many activities are simplified when the services are protocolized and with clear guidelines for the implementation. It facilitates a lot the possibilities into the community pharmacy to offer that service. For instance, the protocols that I mentioned that they are using in Ireland for glucose monitoring, and the blood control, the blood pressure control protocols that are offered in Argentina.
Thanks, Jorge. We've actually had a question come through as well regarding some of the services that you've mentioned, and whether pharmacists are remunerated as part of the service package to deliver some of the services, particularly around self-care.
So I think that getting to a remunerated pharmaceutical service is not a easy way. It's not something that happens one day to other. It is brick by brick. As I mentioned, the blood pressure service that we are offering today is a work that historically it is services that was offered into the community pharmacy, but it was in 2017 when COFA, my association, make a network with the Hypertension Society, and they say, okay, let's move together, but let's record what we do. We start with the recording, and in 4 years, we could record more than 100,000 records. And it was just the first step. We were working without remuneration, but the very important is to start recording, making the protocols, following the steps, and then showing them, as I mentioned in the end of my presentation. It is very, very important, because if we don't record, we don't present, we don't show what we are doing, nobody will know. So I think that that's the way, is brick by brick. And when we have a lot of data to show, then data will talk by their own.
Thank you, Jorge. So I guess you're saying that the way that you've gone about it is around obviously building up the evidence base to be able to help convince commissioners, I guess, to help fund services like this, which are beneficial to patients or patients such as ones, in the fact that you've had 100,000 to the services, which is a huge credit. We have got about 5 minutes left, so I'm just going to go round the panel, if that's okay, just to get any final remarks from each of the panel. I would be interested, as part of your final remarks, if you have any views or thoughts as to anything else that we can do to help support pharmacists, to help support patients, to move this forward. We've got a lot of information from attendees at the webinar of their views and inputs, and I would encourage you to carry on doing the same to give us that feedback. But any additional views, please do give us a quick summary. So, Zina, can I hand over to you first?
I really couldn't hear you well, so I don't know what you. I know you. I can see you called my name, but I really don't hear you very well.
Sorry, can you still hear me now?
It's better now.
Yeah, sorry. I was just saying we've got about 5 minutes left, so I'm just going to quickly go round each of the panelist members. Just to, if you wouldn't mind just giving us your views, just basically a summary with regards to pharmacists' role, basically how we can support on self-care, and if there's any lasting nuggets of information that you want to impart that we should be doing going forward to help support on this agenda.
Okay, so my 2 cents is just going to be that, thank you for that. It's just going to be that data literacy, it's very important for us as practitioners, and so that we can stand an opportunity to better educate our patients on the opportunities that are available in using technology to support themselves when it comes to self-care, because that's the way things are going and you can't stop it. It's inevitable, in as much as there are traditional roles that pharmacists will have always, or healthcare workers will have. Technology has come to stay. So we also been taking that initiative. It's like the issue with vaccination. Pharmacists are vaccinating now in a lot of places where they didn't used to vaccinate because of COVID-19. So that is something that change happened with time. I mean, so this is another change that has come on board, that there is this whole conversation around technology, around artificial intelligence, machine learning, or whatnot, wearables, apps, smartphones, smart apps. So we ourselves need to be in a position to better advise our clients on how best to use these, because it could be dangerous in the wrong hands. So we need to be in a position to better advise them on how to get the best use out of it. And as well, in the whole process, putting them at the center of it all, the patients at the center of it all, and we helping them along that continuum of care.
Thank you. Jorge, I'm going to pass over to you next.
Can you hear me?
Yes.
Okay. So I think that to make a conclusion, the attention must be focused on the patient. It is very, very important. beginning with the knowledge of their health process and non-drugs alternatives, right? Then, once the time for the medication has arrived, pharmacists can offer alternatives to their prescription, and the patients are the ones who can make the decision in which brand to take. For example, here in Argentina, we have the generic name prescription law, and looking toward this focus on the patient, I think that apart of the constant training and education in specific pharmaceutical services, I believe that training in soft skills become essential for the pharmacists, in good communication, in empathy, in respect, are skills and values that must be paramount at the counter in order to achieve this. It is, I think, very vital and very important that the pharmacists be educated and trained in these areas of knowledge.
Thank you. And Koudmani, I purposely left you for last on purpose because I think it is really, really important to say that the patient is at the centre of this, as Jorge's just said. So I'd really appreciate your views basically around what else we can do, your take from this, just within the next minute or two from a patient perspective, because it is so key.
I think if you follow any other industry out there, you find that the consumer is the most important innovator and support to the pharmacy. It's actually an economic argument I'm presenting that the most successful pharmacies will be those who have developed very good patient relationships and patient insights. Reason being that you want repeat buyers and you're competing with online. I still maintain that buying OTC or prescription drugs is not buying other things. It's a social thing. And the pharmacies that will beat that online services will be those which give that extra point, that give that extra community feeling and engagement of patients and involve them in all their day-to-day activities. So patient engagement is commercial success for the pharmacy.
Thank you. That's very, very true. Yeah, very, very true. I am going to pass over to Farah. I'd just like to say thank you to all our panelists for a good discussion, basically in answering the questions and to the questions that we actually had through the chat function as well. So thank you very, very much for all your active participation in that. Farah, I'm going to pass it to you.
Thank you very much, Tracey, and thank you everyone for staying with us until the end of this digital event. Thank you to our speakers and thanks to the panelists as well. Before we say goodbye, we would like to invite you again and remind you to participate in our needs assessment survey. We've prepared this for you. Please do share it across your network. We want to ensure that we're covering all countries, and it will help FIP understand the current level of knowledge and practice on self-care across the globe. Please use the link that we shared in the chat box, and if you have any questions, don't hesitate to share this with us. Again, we appreciate your time, we appreciate your input, and this will help us improve our work and support you better in your self-care practice. Again, thank you for joining us and for your active participation, for the questions you shared. We hope you found this event valuable and enjoyable. I want us to stop sharing our slides now. I just want to say again, thank you to the great chair and the co-moderator, Professor Tracey, the speakers, panelists, and facilitators, sponsors, and organizers for making this event possible and successful. So I'm going to ask our speakers to wave goodbye for the participants, and we wish you all the best in your self-care journey, and we look forward to seeing you again soon. Stay safe and stay healthy. Bye-bye.